Hello, my name is Natasha Davis, and I'm presenting my condition presentation on neurocognitive delirium. I am role B of this presentation. The introduction of this condition, delirium, is a neurocognitive disorder cited in the DSM-5 as a substance-related and addictive disorders. Um, this presentation will include an overview of the condition and the diagnosis criteria, a short video explaining the disorder, and then a summary and an explanation of the article about the disorder, and a few national web resources. Um, Overview of the condition. Delirium is a disturbance in attention and awareness. The disturbance develops over a short period of time, usually hours to a few weeks, presents a change from baseline attention awareness, and tends to fluctuate in severity during the course of the day. In addition, disturbance in cognitive memory, disorientation, language, visual, spatial ability, or perception. Disturbances in the A and B are not better explained by another pre-existing, established, or evolving neurocognitive disorder and do not occur in the context of a severely reduced level of arousal, such as a coma. There is evidence from the history, physical examination, or laboratory findings that the disturbances is direct psychological consequences of another medical condition, such as a substance intoxication or withdrawal due to a drug abuse or to a medication, or exposure to a toxin, or due to multiple etiologies. Here's the video on the related condition, what is delirium. And then there was an article. This article was basically um, more so in the healthcare setting, in a hospital, as I reported that most delirium patients are usually exposed to delirium. I mean, most patients are exposed, older adults or seniors are exposed to delirium, or has had some type of experience with it. And that's basically what this article was about. Delirium is the most common neurological condition that is mostly among older adults that are in a long-term hospital setting, which is associated with negative outcomes. Delirium mainly happens to older people exposed to stress, including acute illness and hospitalization. The best way to reduce human suffering is to improve knowledge and education to healthcare professionals. I've known, in my experience, I've had clients that has experienced delirium, and at that time I didn't even know what that was. Just working with the clients. I'm a mental health tech, um, so I have experience in the mental health field. So yeah, I mean, I didn't even know what delirium was when I experienced. I remember recalling. Um, at that time when I did was a mental health tech of a person or older individual with delirium, even family members that are in nursing homes experiencing delirium. Usually they will come out of it. It's like a really acute stress that is related to the condition. So it's not permanent, it's usually temporary. Um, that was my experience with delirium. Sometimes medication can cause delirium. And it was like, wait, this person's not at their baseline. What's going on? So that was always like a red flag to me. Um, Now that I think about it, that they have experienced delirium. I selected 3 national web resources on delirium. I'll click on the first one. Of course, this is in a hospital setting. Increased post-operative cognitive dysfunction risk in older adults, but usually in the first month. So this article basically discusses delirium with patients that, who just came out of surgery and is extremely stressed. And, in their recovery, they experience delirium. And they usually say it's common in post-operative complication in older surgical patients. Um, and they did a study on delirium. So this was the first National Web Resources Anesthesiologists, American Study of Anesthesiologists, basically talking about delirium after surgery. All right, I'm gonna go back to the PowerPoint. The next is Beyond the Basics of Delirium. This is a second national web resource selected. This basically gives over overview of delirium. Of course, goes into more web resources. Delirium is acute confusion state characterized by alteration of consciousness with the reduced ability to focus, sustain, and shift attention. The results of the perceptual disturbance that is not better accounted for by pre-existing, established, or evolving dementia. Delirium develops over a short period of time, usually over hours to days, and tends to fluctuate during the course of the day. Delirium is typically used by a medical condition, substance intoxication, or medication side effects. So this is another web resource of delirium. Go back. Of course, this is another link of delirium in adults, delayed emergence and emergence delirium in adults. Um, Introduction, failure to return to normal consciousness in a normally timely fashion following administration of general anesthesia may manifest in delayed emergence or emergence delirium. In most cases, these conditions are temporarily and gradually resolved, and anesthetic agents are metabolized and eliminated. So here's another one, web resource. Here's another one. Um, Palliative overview of comprehensive patients assessments and palliative care. Introduction. Palliative care is an interdisciplinary medical specialty that focuses on preventing and relieving suffering and on supporting the possible quality of life for patients who are facing a serious or in life-threatening illness and their families. So just basically not introduction, education on delirium. Of course, patients' cognitive impairment and clinical features and diagnosis of cognitive impairment and delirium in patients with cancer. So, of course, there's a lot of suffering with patients that are dealing with delirium. It's very distressing to the patients and the family. Of course, it's hard to see our family members or loved ones experiencing delirium when they're confused or not knowing what's going on. Um, Especially as the side effects of coming out of surgery. It seems like it's extremely painful. Well, the pain that they experience kind of takes their mind. The delirium kind of takes over their mind. Acute stress. Another, web resource is from Psychological Today. Delirium is also referred to as acute confusion state or acute brain syndrome. It is a condition of severe confusion and rapid changes in the brain function, shorter in duration than dementia. It comprises a cluster of symptoms that may result from a treatable physical or mental illness. Delirium can also be a side effect of some medication. Here are some DSM-5 criteria of delirium, which we already discussed. A short disturbance in attention and awareness, which develops in a short period of time, usually over the course of hours or a few days, represents a change from typical levels of attention and awareness, tends to fluctuate in severely of the course of the day. In addition, disturbance in the cognitive memory, language, and perception or orientation to time or place. Um, Delirium may coincide with a disturbance in the sleep wake cycle, including examples of sleepiness during the day and wakefulness at night, as it is as well as in a person's emotional state, which may shift unpredictably. Patients with delirium may switch quickly between hyperactive and hypoactive states. Prevalence is highest amongst hospitalized older adults. Individuals affected of an estimate of 14% of individuals over the age of 85. Delirium often lasts 1 week in a hospital setting, but symptoms may persist longer. Delirium can cause progress to a coma or death, especially if the underlying cause is not treated. Delirium is usually the temporary result of a physical or mental illness. It can be caused by disorders that are perceived the brain or the oxygen or other substances that may result in accumulation of toxins in the brain, such as drug use, overdose, withdrawals, infections such as urinary tractions, poisons, severe sleep deficit, and general anesthesia among the varied causes of delirium. And of course, the treatment varies depending on the specific condition causing delirium and may require hospitalization. Some medications that worsen confusion, such as alcohol and illegal drugs, um, may cause be stopped or changed. Medication or behavior interventions may be used or intervention treatment or to control hazardous behaviors. Tools for increasing orientations to be one surrounding and uses of eyeglasses and hearing aids may also be helpful for individuals with delirium. So those are the three web resources that I found. Oh, so those were the three web resources that I found. I'm sorry, the screencast automatic cut off. And this is the references. Of course, we use the APA format. Their video, what is delirium, of course, web resources. And delirium, I found it to be very interesting. I had no idea what it was about when I first clicked the condition. But after, doing some research and reading and understanding, I, began to realize like, hey, I've had experience with patients with delirium. They were not at their baseline. Something is not right. Um, and in those type of situations, we tend to find out what's the cause and what's the reason behind um, this cognitive disorder. And that, at that time, of course, I didn't know what delirium was. But now, after reading and having being educated on delirium, I find it very confident when trying to make or attempt to make a diagnosis. Um, And I learned a lot from this condition. Um, that's about it.